Now, a lot of people think Parkinson's only happens at an old age, but can it affect the younger population as well?
Yes, so in such cases, it is important to look for the family history because there are certain type of genes which can actually cause this Parkinson's even in the younger age group. Parkinson's is a neurodegenerative disease.
Okay.
So it is usually seen in the elderly age group and it happens due to death of certain type of brain cells which are important for the production of dopamine. This dopamine is a chemical messenger in the brain which will help in facilitating the movement. So its deficiency basically leads on to Parkinson's disease.
Alright.
In fact, in the olden days, this Parkinson's disease was called a shaking palsy because the shaking of the hands or the tremor was the most common symptom that was observed in these group of patients.
Why does it happen?
This dopamine is a part of many pathways that happen in the brain. The movement is basically initiated. So whenever they're turning around or when they're traversing through narrow passages or the crowded places, they tend to freeze suddenly.
You are tuned into India's most happening radio station, Fever 104 FM. This is Shine on the Superhero Show, and every Thursday between 6 to 7, it's time for Health Waves, courtesy Kauvery Hospital, Marathahalli. Joining me on the show today is Dr. Sushmitha Reddy from Kauvery Hospital, Marathahalli. Ma'am, first of all, thank you so much for taking time out and coming to our studios. I understand this is your first radio interview.
Yes, that's right.
Okay, all right, ma'am. I understand you're a little bit nervous, but we are speaking about a subject that you are already an expert in. Before we go ahead, if you could kindly introduce yourself for our listeners.
Yeah, thank you, Shan. Thank you for having me. So, I'm Dr. Sushmitha Duvurru. I'm consultant neurologist at Kauvery Hospital, Marathahalli.
All right, ma'am. Welcome to Fever FM. Today we will talk about Parkinson's. And you know, I saw a friend's father recently struggling to button his shirt. His hands were trembling and you know, he moved really slowly. So everyone thought it was old age because that's what we see. But later on they found out it's Parkinson's. Can you tell us how does Parkinson usually start? What is it and why does it happen?
Well, Parkinson's is a neurodegenerative disease.
Okay.
So it is usually seen in the elderly age group and it happens due to death of certain type of brain cells which are important for the production of dopamine.
Okay.
Right. So this dopamine is a chemical messenger in the brain which will help in facilitating the movement. So its deficiency basically leads on to Parkinson's disease.
All right.
In fact, in the olden days, this Parkinson's disease was called a shaking palsy because the shaking of the hands or the tremor was the most common symptom that was observed in these group of patients. But other than tremor, there are a few other symptoms that can commonly occur in this Parkinson's, like stiffness of the limbs or the tightness of the limbs. There can be reduced facial expressions. The face becomes like a mask. And they become very slow in their activities like walking, eating, dressing. They become very slow. So they'll have difficulty to keep up the pace when they're walking with their friends or family members. And they'll also have difficulty to turn around suddenly. So when we walk normally, there is a movement of the hands also that happens simultaneously.
Right.
But in these patients, the arm swing is also reduced. And in advanced stages, when the Parkinson's becomes more, so they'll have severe postural instability. So they tend to have frequent falls because of that. And sometimes there can also be the motor freezing, the blocks that can happen suddenly. So when they're trying to initiate the movement, when they're trying to get up suddenly from the chair or the bed and they try to take the first step, they freeze there suddenly.
Can you tell us why does it happen? A little about that as well.
Yeah, so as I told you, this dopamine is a part of many pathways that happen in the brain,
Right.
a direct pathway through which the movement is basically initiated or facilitated. So again, this deficiency itself is the main reason that causes this blockage. So whenever they're turning around or when they're traversing through narrow passages or the crowded places, they tend to freeze suddenly.
Okay.
So these are some of the common symptoms that are seen and the patients come up with these symptoms. So whenever you start seeing these kind of symptoms like slowness or some imbalance with falls and there's some shaking of the hands, so don't think, oh, it's just aging. So come do see a neurologist and see what it is exactly.
Now, a lot of people think Parkinson's only happens at an old age, but can it affect the younger population as well?
Right. So Parkinson's disease is commonly seen in the elderly age group, as we all know, but it does occur rarely in the younger age group as well. So in such cases, it is important to look for the family history because there are certain type of genes which can actually cause this Parkinson's even in the younger age group. So it becomes important to evaluate and to identify the genetic cause behind it in cases of this young onset Parkinson's disease.
Okay. Now, if somebody's family member is diagnosed with Parkinson's disease, how can they help? Can they slow down? Can they make everyday life easier for the patient who is suffering from Parkinson's disease? What can a family member do?
Definitely, families do play a very crucial role, in fact, when it comes to the management of the patients, because emotional well-being is as important as the physical well-being, right? And this emotional support comes from the family members.
Right.
So, in Parkinson's disease, the disease is a chronic disease. It is progressive.
Okay.
So, anybody when a diagnosis of Parkinson's is made, it is not easy for them to cope up with. And the disease per se can also cause mood changes. So, being patient with them, being empathetic, and providing reassurance will definitely help. And also, you can motivate them constantly to be more active physically or to do exercise on a regular basis so that the postural balance improves. And that is how they regain their confidence within themselves. And also, they can help by providing adequate nutrition. Yes, the journey is challenging, but with continuous support from the family members and with proper neurological care, the quality of life can still be improved.
Okay. Now, there's a lot of fear around Parkinson's. Can you tell me, like, we've heard that Parkinson's is no cure. So, what is the life like of a Parkinson's patient? Can they live a good life if proper care is, taken care? A proper care, if they get proper care.
Parkinson's disease being a neurodegenerative type, there's no cure. But having said that, we do have many promising therapies that can help in managing these patients. So few patients respond excellent to the treatment. Then they continue to lead a normal independent life. But some patients do not respond that well. But however, there are many therapies that can be helpful. Like we have oral medicines or the injections, surgical options, and physical therapies. All that might help. But the key factor here again is being under a regular follow-up with a neurologist so that the disease progression can be closely monitored and the treatment also can be adjusted as and when required. So all this will indirectly help in improving the outcomes.
Okay, all right. We often hear that Parkinson's as if it's, we often hear about Parkinson's as if it's one single condition, but are there different types of Parkinson's that people should be aware of?
Yes, Parkinson's is not just one type. There are many subtypes in that. So Parkinson's disease is the classical Parkinson's type. Okay, so this is called idiopathic Parkinson's, where the exact cause is not identified. But the other type is Parkinson's plus, that is atypical Parkinson's. Again, there are many types like PSP, CBD, MSA in that. So again, it becomes important because the idiopathic Parkinson group of patients respond very well to the treatment.
Okay.
With this Parkinson plus or the atypical Parkinson's group, they might not respond that well. So there are certain red flags to when you should suspect this atypical Parkinson's. So when there's early speech involvement, or when the memory disturbances start very early in the phase of the disease, or when they have frequent falls within first 1 year of the disease, or when they become wheelchair bound within 5 years. So in all these cases, we start thinking that okay, it is not just idiopathic Parkinson's; it's a type of Parkinson plus.
Right.
And there's also something called heredodegenerative. As we discussed, there are some genetic causes that can also cause Parkinson's. And the other last type is secondary Parkinsonism that can cause secondary to certain type of drugs or infections and stroke. So all these also can cause Parkinson's disease.
Okay. Without naming anyone, doctor, can you tell us about a case that you've seen, like somebody who was probably misdiagnosed and the Parkinson diagnosis was done much later, and how were they treated after that? Where are they now? How are they doing?
Okay, sure. I can remember this case, like this patient who has come to my OPD recently. He was a middle-aged gentleman, so he was accompanied by his spouse. So when he came to the OPD, his only complaint was that he had some imbalance while walking and he has fallen down. Okay, but on taking detailed history, on repeated asking, the spouse also started saying that she noticed some slowness when he was walking. So he was lagging behind her when they were walking together. So then I went on examining, and then I confirmed that there is bradykinesia, that is slowness, and there was also rigidity, the tightness of the limbs, and there was also mild tremulousness of the hands. So there were clear-cut signs of Parkinsonism. Then I asked him, was he taking any drugs on a regular basis? Then he showed me his old prescriptions. Then I noticed that yes, he was taking certain drugs which could cause this Parkinson's. Then immediately I asked him to stop those medicines, and I've also started him on treatment for the Parkinson's. Later he came, I think, very recently for follow-up. So then now he's doing much better. His balance has improved. There are no further falls, and even the tremors have come down.
Okay.
So again, to stress on the fact that all Parkinsons are not the same, this drug-induced Parkinsonism can be even reversible.
Doctor, can you tell me what are some of the other signs of Parkinson's that we might sometimes probably miss out on? Like, for example, I read that Parkinson's apparently starts in the gut, and the stomach is related to Parkinson's as well. So, can you shed some light on that?
You're right. In fact, gut is called the second brain. So, according to Brack's hypothesis, the Parkinson's disease actually starts in the enteric nervous system, that is the gut.
Okay.
And then it goes to the nervous system. So, whenever there is alteration in the gut microbiota, that is when there is increase in the harmful bacteria and when there is decrease in the beneficial bacteria, it is called gut dysbiosis. So, this gut dysbiosis indirectly affects the brain health also in multiple ways. So, the vagus nerve is the common connection basically. So, whenever there is gut dysbiosis, it affects the vagal nerve activity. And this vagal nerve activity thereby affects the brain activity. So, other possible ways that whenever there's this gut dysbiosis, it can cause inflammation in the gut. And this will lead on to further inflammation in the brain.
Okay.
And also there are many other metabolites, in fact, like short chain fatty acids. So, these are released in the gut, and these are very important to maintain the integrity of the blood-brain barrier, so which is like a protection to the brain. And when these are not properly released, there's a compromise in this barrier also. So, by following a healthy lifestyle, by eating healthy and including fiber-rich diet, and also following the Mediterranean diet, especially which is rich in more fruits and vegetables, including whole grains in your diet, healthy fats. So all this will help not only in improving your gut health, but also it helps indirectly to improve your brain health.
Okay, so doctor, if somebody who is listening to the show right now just got a diagnosis, or if a family is scared for their loved one, what do you want them to know? What's your message to them?
Right. So I know this is way too much to take in, and it can be overwhelming.
Right.
But what I would like to say is, many patients with Parkinson's continue to lead a fulfilling life when there is right treatment and right support. So there's no need to panic. We are here with you in this battle. You're not alone, and we're there to support you with each phase of this journey. And together we can fight this.
All right, Dr. Sushmitha Reddy, thank you so much for coming here to our studios. What you told us was important for everybody to know. It is slightly alarming as well, but very important information. So, thank you so much. I hope you have a nice day ahead of you, ma'am.
Yeah, thank you, thank you.
And I hope your first visit to a radio station was pretty decent.
Yes, yes.
Can we say that? Yes.
I enjoyed it. It was good.
Okay. All right. Dr. Sushmitha Reddy from Kauvery Hospital, which is located in Marathahalli. We've got much more coming up. This was Health Waves, courtesy Kauvery Hospital, Marathahalli. You got to stay tuned.